We are joined now by Dawn Allensworth-Davies, who's the Scientific Program Chair, as well as Christina Dragon, who's the Chair of the LGBT Caucus. Thank you both for taking the time to talk with us.
Thank you.
Thank you.
Christina, let's start with you. What are some current policies and practice that threaten the health and well-being of LGBTQ plus individuals?
I think the most important policy and practice is the lack of relevant and accurate data collection documenting the health and wellness of LGBT people. Sexual and gender minorities historically have not had a lot of data collection, and you can't measure or improve or reduce health disparities when you don't have data about those people.
Dawn, this one's for you. What are unique challenges of developing interventions for people of color who are LGBTQ+?
We've actually talked a lot about this in terms of our scientific programming, and I think a lot of it really boils down to trust. And I also think it's important to recognize that people of color can't just be lumped into one group. Each of them have their unique cultural issues, and when you combine that with also being LGBTQ, it becomes very, very challenging. So the first step, I would say, would be to establish a foundation of trust with these communities, have a rapport with them, and make sure they're involved in every stage of the intervention process. A community activist in Cleveland has a great saying that I'm completely behind: nothing about us without us. And I think that's absolutely the approach that we need to take if we're going to involve communities of color in a way that benefits them and is effective for them in the long term.
Mm-hmm. Christina, will you share with us some successful strategies that are advancing equity for LGBTQ plus youth?
Yes, absolutely. So earlier I just mentioned that data collection is absolutely vital to improving health outcomes across the age spectrum. And one of the most notable improvements and benefits is that the Youth Behavioral Risk Survey has added sexual orientation questions to the core set of questions for all students, and that is a remarkable advance, because now we can see breakdowns on bullying or substance use by sexual orientation for students, and that's a huge and measurable, quantifiable advance for us.
Dawn, how can schools better understand the priority of the issues facing LGBTQ youth?
Well, I think for LGBTQ youth, I think it's important to understand that four of the key priorities for them would represent bullying, substance use, homelessness, all of which can contribute to increased suicidality. And so recognizing mental health and diversity early in the schools and having counselors who are trained to address that, I think, is very helpful. And I think it's also important for schools to create a safe space for their LGBTQ students, where they can come together with peers to explore their sexual orientation and their gender identity. And to the extent they can also partner with community centers in this endeavor, I think will just strengthen that approach.
Thank you both so much for talking with us.
Yep, thank you.
APHA TV has more exclusive content you can check out by clicking on the links to the right. Be sure to check back each day for brand new interviews, stories, and more from the conference. You can revisit past years of APHA TV by visiting our channel.